I'm just wanting to know, what is regenerative medicine? What does it mean? What is it?
Regenerative medicine, it is a newer term, and it's kind of that on-trend term because it's a new technology. What we're doing is we're using protein-rich platelets. We take some of your own blood, we isolate those growth factors, and we can inject those into damaged shoulders, damaged knees, damaged tissues. But what's so wonderful about this is we can take those same platelets, we can isolate them, and we can put them on the face. And it does a great job at reducing wrinkles, fine lines, and even scar tissue. So now we're using your body's own healing mechanisms to put into these different areas to accelerate the healing and to really accelerate a potential for growth and healing in any damaged tissue. The reason why that happens is because your ligaments and tendons, they're not highly vascularized. That's why they're so powerful, but when they do get damaged, we don't get a lot of blood supply to the shoulders and the knees. So they often don't heal that well. So yes, we have chiropractic, massage therapy, infrared lasers, nutrition, detoxification, which all help. But if that damage is there from scar tissue, if you didn't get in quick enough to get that injury taken care of, that scar tissue is going to be around a long time, that's when we do the PRPs. That's rejuvenative medicine. It's incredible. We also have a component of that rejuvenative medicine that I'd like you to explain if you would, because this is your forte in the rejuvenative medicine arena, or regenerative medicine arena, and that is with PRPs and sexual health and vitality.
Yes.
What would that be?
So I'm having a lot of really satisfied PRP patients with all procedures that we're doing. It's really exciting. But one, especially with Valentine's Day coming up and all the love in the air, is for sexual rejuvenation for both men and women. So it's really exciting. It can help men with erectile dysfunction, but it has some added benefits. It increases sexual arousal, stimulation, or sensitivity.
Yes.
You'll get some enhancement in length and size. Yes,
Okay.
I did say an enhancement in size. For women, they'll have an increased frequency and intensity of their orgasms. For some women, this may be just the ability to achieve an orgasm, which is huge. And we also have an added benefit to decrease some mild urinary incontinence with that as well. So whether it's for a medical condition or just to vamp up a little bit, for Valentine's Day, it's a safe and effective procedure.
And that's it. It's a safe, effective procedure that only complements a person's potential.